Flint Lead Exposure Registry. Description of the program. The Flint Registry is a voluntary public health registry created to identify individuals affected by the crisis. It provides services, long-term monitoring, and supports their recovery. It enrolls residents. It documents their exposure and health needs, provides referrals, medical, legal, and social, produces reports, and generates interventions and policies. It was funded by Congress and the CDC under the Act of the Water Infrastructure Improvements. It was originally a 4-year grant. Why it was created: during the year April 2014 through October 2015, 99,000 residents of Flint, Michigan were exposed to lead when their water sources from the Detroit Water Authority to Flint water systems. And then in December 2015, the lead contamination was declared a state of emergency. The registry was created for anyone living in the city of Flint from the dates listed. This includes children who were exposed during pregnancy. It is to address both immediate and long-term health, social, and environmental consequences in a largely marginalized community. It was created by the Flint Water Advisory Task Force. The next slide is just a picture of the timeline of the Flint Registry. Kind of shows you the years it's been active. The Flint Registry collaborations listed below. The academia, Michigan State University kind of leads the operation and evaluation. The federal and state agencies, the Michigan Health Department obviously involved, the city of Flint. There's lots, the CDC is kind of the funder and they provide a lot of oversight in this. Local health providers and hospitals, there's quite a few that are involved. There's a slide a little bit later that shows them all. They're clinical partners. They provide screening, follow-up, and referrals for the lead-related conditions. Community organizations that help conduct outreach and enroll residents. Local governmental agencies, city partners, task forces, local legal advocacy agencies kind of all help get people enrolled and get the referrals that they need. How the program improves quality of life. It kind of links people to services. The registry enrolls Flint, Michigan's residents to medical care, developmental screening, mental health services, lead remediation sources, and social services. This reduces the barriers for low-income, predominantly Black neighborhoods that were disproportionately exposed to the lead. It collects data. It has been used to prioritize pipe replacements, clinical outreach, funding, kind of towards the most affected neighborhoods. It also employed a lot of local staff and partners in the community, so created a lot of jobs for Flint, Michigan. This purple link is the inaugural report, so it's the kind of the first report that the Flint Registry made when they were given the funding. So it shows like the different types of conditions that they reported, the numbers. There's just a lot of great information in that report. Here's a list of the service referrals that they have: lead elimination, health and child development, and nutrition. Kind of a couple different things that they have available for people. And then all of the partnerships that are available to people kind of within Flint and some of the surrounding areas. The impacts on public health. The registry created a longitudinal data set to study the lead exposure outcomes, kind of providing clinical care guidelines and public health interventions. So far, MSU has reported that the registry has enrolled 11,735 people, and they provided 17,848 referrals. They've also been able to, kind of based on their data, replace 11,000 lead pipes in major infrastructure to mitigate the lead. Limitations and lesson learned. The trust and participation, there's a lot of historical distrust in the government, which slowed engagement, which is why of the 99,000 participants, only about 12,000 are enrolled. Also, the legal operational complexity, all the interagencies cooperation was kind of a little bit of a challenge for them. And then the sustained funding, their original funding ran out in 2021 and it has been renewed. 2022 was independent and they did get a grant of $18 million in 2022 to continue their research. The FlintRegistry is an example of using collaborative interprofessional health programming to address an environmental health disaster and its inequitable impacts. By combining surveillance, service linkage research, and community engagement, the registry has improved access to care, informed remediation policy, and provided a model for other jurisdictions facing environmental exposure. It demonstrates that the registry-based collaborative public health programs can both mitigate harm in marginalized populations and generate evidence needed to prevent future harm. The references were cited throughout the presentation. The Jones report, the inaugural report on slide 8 is highlighted in purple. It provides kind of the information about the data they all collected. It gives great statistics about what they did and the people and all the kind of different data that they found.